Jonathan Tolberg for Biz News. A drug meant for diabetics that causes weight loss is gaining popularity worldwide. Famous personalities such as Elon Musk claim to have used it, with the popularity starting, as always, in Hollywood. And I have Muhammed Vally, head of the Division of Clinical Pharmacy and a lecturer at Wits, to discuss this. So, hi, Muhammad, and welcome to Biz News.
Hi, Linda. How are you?
Well, thank you. Tell me, what is, it's called semaglutide or Ozempic. What exactly is it?
Well, semaglutide or Ozempic is a drug that was initially designed for diabetic patients, as you pointed out, right? It was what they call a glucagon-like peptide, GLP-1 analog. And essentially what it was meant to do is it was meant to actually reduce the amount of insulin that diabetics actually release, right? So essentially it was meant as kind of a drug that would help them basically to control the blood sugar better. And what they found is one of the good things about this particular drug is it also improved patient satiety. In other words, it made them feel fuller quicker. And then therein, what happened was people started to lose weight. So it's actually not the first drug in this class that particularly results in weight loss, right? There are other ones. There's liraglutide, there's dulaglutide. All of those also cause weight loss, right? So when they initially had this idea, they decided, okay, well, let's have a look. So the first one that they tried this with was liraglutide. Now, liraglutide is a daily injection. It's a bit different from semaglutide or Ozempic, as you call it. In that, semaglutide or Ozempic is a weekly injection. So already there's a difference, right? And what they did was they did an investigation, a clinical trial in non-diabetic patients this time to see whether or not they would lose weight. And in fact, they actually did lose weight. Relatively speaking, about 6% of patients, there was a 6% reduction in weight loss with liraglutide versus the placebo, which was only 2%. So roughly the difference is about a 4% weight loss reduction, right? And the thing then got them thinking, okay, so if this works with liraglutide, maybe it will work with other drugs. So then the next obvious one to try was semaglutide. And so there was a clinical trial that was done in 1,961 participants, which was actually published in the New England Journal of Medicine in 2021, wherein they basically did a double-blind trial where they actually randomized participants to either be in the placebo group or to be alternatively in the semaglutide group. Now, I just want to make something very clear. The dose that they gave here, right, was higher than the dose you would normally give to a diabetic patient. So the standard diabetic dose is roughly about 1 milligram once a week at its maximum dose, right? And in the case of this, they gave 2.4 milligrams once a week. So it's a higher dose, basically. And also what they did is, for this specific trial, they wanted to see whether or not it would work in non-diabetic patients. So they only took non-diabetic patients in this particular trial, right? And the inclusion criteria was that you needed a BMI of 30 or more, or alternatively, you needed a BMI of 27 or more with one comorbid condition. So having cardiovascular disease is an example of a comorbid condition that occurs with obesity or being overweight. So what they did then is they basically randomized these two groups and they looked at them for a period of time, but the entire duration of the trial, the last time they looked at them or followed them up was at 68 weeks, which is roughly about 1 year and 4 months, right? Give or take. And they basically found that in the people who took semaglutide, they basically on average lost 14.9% of their weight compared to the baseline versus 2.4% of the weight versus baseline in patients who were taking the placebo. So there was basically if you minus for the patients who were taking semaglutide from the patients who just took the placebo, there was a 12% reduction. This is quite large. It's much larger than the 4% for something like liraglutide, for example, right? It's a much bigger amount of weight loss that we're talking about here. Now,
so you can see why it's why people, there's this craze about it, and people think that's the solution to obesity.
I can see that. Yeah, that's true. But you have to bear in mind, like anything, right? Even this particular clinical trial that we're talking about now, it's not a drug by itself. It's a drug plus there's the intervention of the diet and exercise and all of that. And I think people get a little bit lost in this, like, quagmire thinking if I take the drug, I'll be fine, I'll lose weight. You probably will lose some weight, but to get the maximum benefit, there's no easy way and there's no easy fix, right? Also, then you must take into account that this was 68 weeks. Essentially, what we're saying is after 68 weeks, nobody knows what's going to happen. And another thing you have to take into account is that if your BMI is not 27 or more with a comorbid condition or BMI of 30 or more, we don't know what's going to happen. Essentially, you have to, if you wanted to use this as a weight loss agent, you have to match the person who's taking it to the clinical trial that was done. That's the only way in which we can guarantee some kind of not necessarily weight loss, but guarantee the effect that you're looking for, essentially. And the thing that everybody's going to ask, and I'm sure you were somewhere at some point going to ask, is about the side effects of taking.
Safety.
Yeah.
Yeah. Is it safe?
So obviously a trial like this is looking at both safety and efficacy, right? Because that's how a clinical trial powered at 1,961 participants is looking at both safety and efficacy. So the most commonly reported side effects were nausea and diarrhea. This goes without saying because of the way in which the drug works. It's more likely to have gastrointestinal side effects, right? The thing that everybody gets concerned about with these particular group of drugs is the chances of it causing pancreatitis. And there was 3 cases of pancreatitis out of, I think it was roughly about 1,300 people who took semaglutide. So if you work that out in percentage terms, and they do this kind of thing, they say it's 0.2%, right? So 0.2% of an event per 100 patient years. In other words, the risk is very low. There is a risk, right? And if you end up being one of those people, the risk is there. But essentially, it's, I don't want to use this word just like willy-nilly. It's safer than you would think. And it's certainly safer in some cases when you compare to the other things, or it's more tolerable rather than when you compare to the other weight loss agents which are available. Like, for example, there's a weight loss agent which combines naloxone, which is an opioid antagonist, with a drug called bupropion. That one increases the risk of suicidal ideation. So you can quite imagine that people would not want to be taking that one, right? Then there's another one which is quite a famous weight loss agent called phentermine, but phentermine is combined with another anti-epileptic agent called topiramate. That one causes what we call cognitive clouding. So people then tend to not be able to feel, they can't think normally like they would before. I've heard people refer to topiramate as like having cotton wool for brains. So, it's quite funny to hear people describe taking that particular drug. But yeah, so relatively speaking, it's a better option. But you have to take into account, unfortunately, people are going to get nausea, they're going to get diarrhea. Obviously, the longer you use the drug, the less the adverse effects, because nausea and diarrhea are the kind of thing that after a while, your body starts to develop tolerance to, so you don't get it as much. But you can also get other things like dyspepsia and heartburn and all of those kind of things. And then, obviously, with anything like this, people will worry about the risk of things like cancer, which is worth thinking about, right? So I had a look at their particular clinical trial, and the rate of cancer was the same in both the placebo group and the intervention group. So in other words, whether people took semaglutide or they took the placebo, the number of cases of cancer was the same. So essentially, no difference. So in other words, in a large group or population of people, if you did your randomization properly, there are some people who will develop cancer, and it shouldn't be out of kilter. It shouldn't be where one group has more than the other.
So, what's the position in South Africa? Because this has now been prescribed on the National Health Service in England. A lot of people can just almost buy it on the internet. What is position in South Africa? Does it have to be prescribed by a doctor?
Yeah, so Ozempic in South Africa has to be prescribed by a doctor. Yeah, by an authorized prescriber, definitely. In terms of whether or not it's being used off-label currently for weight loss, I can't tell you. Because as you can well imagine, right, you might get a prescription for Ozempic, which you can't necessarily tell if it's being used off-label or not, right? Because that kind of information is not disclosed.
Can you just for people who might not know, say what is off-label?
Okay. Off-label is so currently Ozempic in South Africa is only registered for patients with type 2 diabetes to help them to control their blood sugar levels. So it's not registered in South Africa as a weight loss agent. So in other words, what I'm saying is the label indication for the drug is as a drug to help with diabetes to control your blood sugar. So that's the label indication. So if you use it for anything outside that, it's considered off-label.
Yeah. Well, have you any request for, were you guys at Wits, maybe at the hospital, or do you know privately, is there a surge in demand in South Africa now that people know it is effective for weight loss?
So actually I looked this up and there have actually been a few articles written on this. Obviously this is all anecdotal evidence, so it's a bit hard to say for sure, but there seems to be where the supply seems to run out of stock relative to what was happening before. So I think that you can kind of infer from that, yeah, it's now probably being used more likely as a weight loss agent than for diabetic patients. That being said, there probably are a large number, and this is probably true, right? There are definitely a large proportion of diabetics who are overweight. So their doctors may have now decided that, listen, this looks like a way in which we can help them to lose some weight and control their blood sugar simultaneously, which again is not, in that particular scenario, is not an off-label indication because the original clinical trial was designed for diabetic patients. So
yeah, I spoke to one GP down at near George who told me that she's getting more and more requests from people who want to lose weight, and some might not be in that BMI of 30 that you're talking about. Which, it's interesting when there's such a hype about it. People might think that's a quick, easy way to lose weight.
Yeah, and again, remember, safety and efficacy is what we're speaking about here, right? And you wanted to know whether or not it's safe and whether or not it works. So the only way that it's safe and works is if you can match the person to the clinical trial, because that's the only information that we actually have. After that, it's pure guesswork. So if it's somebody who doesn't fit into that category, then it becomes extremely difficult to then decide, like, okay, whether or not to give them the Ozempic or not, or the Semaglutide. You understand? And again, I want to point out that the dose is different, right? In South Africa, we only currently have Ozempic. We don't have Wegovy. Wegovy is the 2.4 milligram dose, which is the higher dose for weight loss. So as a result of that, like I said, you'll definitely get weight loss with a 1 milligram dose, but you may not get it to the same extent as what we just spoke about based on the clinical trial that was done in 2020. Well, was published in 2021. It's obviously done before that.
And also you need to inject it. I mean, that is quite a barrier for some people. It's not
that probably would be a barrier for a lot of people, but I mean, there are ways around that particular thing, right? What we know about insulin, for example, is that there's a higher barrier, there's a higher physician inertia to prescribing insulin, thinking that patients will not actually be able to inject themselves. People over a while or a period of time tend to get over the fact that they need to inject themselves or somebody needs to inject them, It's like anything in life, if essentially the first, second or third time you do it, you are quite afraid of it. And the more and more you do it, the less afraid of it you become. And I mean, the attractive thing about semaglutide obviously is that it's a once a week dosage, It's not like I have to inject myself every day.
Yes. Well, obesity is a problem in South Africa among us because we are, a country that has poor people and rich people.
Well, I mean, I think if I'm not mistaken, and you will have to probably double check this, I think we have the highest rate of obesity in Sub-Saharan Africa. So it's not like we don't have a problem. We've got a serious problem.
And the whole thing is, as soon as you stop using it, the weight might just pile back on. Okay, I said, and the other problem is once you stop using it, the weight might just pile back on.
So this is the thing we don't know, right? And this is the thing that we will have to see now over a period of time. I don't think that all the weight will pile back on, because from what we know about drugs like liraglutide and things like that, for example, in diabetic patients who were using liraglutide, as long as they continued using it, they still maintained a proportion of weight loss. Now, the question is whether you stop using it, whether or not you'll still be able, whether you will pick up all the weight again. And here's the thing, right? Like with anything that you use for weight loss, right? If the person themselves is not motivated and they don't want to change their lifestyle, do the exercise, all of those kind of things, then definitely the weight is going to come back, right? The proportion may not be the same, but it will come back, unfortunately. And I don't mean this in a way because it's now considered like a problem when you say this, like like you're trying to shame people. I'm not. I'm just explaining that it's difficult. Life is difficult to begin with, and people eat and don't do exercise for a variety of reasons, some of which are related to their lifestyle and the stress and all of that. So I think that motivation is something that's extremely important. And if you're going to use these kind of agents, motivation is something that you need.
Well, willpower is also important, but you said this might actually just be a little kick to help that will.
Yeah, I think that's true. I think, the problem that I've seen, particularly with patients who are obese, is they want to actually lose weight, right? But what happens is that they just need that little bit of like a boost or a little bit of a kick to try and help them to actually lose the weight. And this might actually be the way in which that happens. So I don't think it's something we can like, the famous saying, throw the baby out with the bathwater. I don't think we should just completely dismiss this idea. I think it's something that you do actually have to look at.
Thank you, Muhammed Vally from Wits.